Hi, it's Dr.Brajendra from Indore, India. Today I'll be sharing you with my experience with the piezotom. 1.5 years back, a patient called me, do you do ultrasonic rhinoplasty? And it was a shock to me. I didn't know what is ultrasonic rhinoplasty. Then I inquired about it and I realized that maxillofacial surgeons are using it for a long time, but rhinoplasty in India at that time nobody was using it. So I got the kit from France and last 1.5 years I am using it. I have no conflict of interest. Basically, the ultrasonic bone cutting tools have a unique property. They are useful in bone work, fine osteotomy cuts, precise bone removal, rasping, better achieved with piezotom than any other equipment. It has tremendously improved the fineness and the rhinoplasty results, and it does not damage the mucosa, nerves, and vessels. Now, especially useful when there is a sharp angulated bone septal spur when which you are trying to remove the chisel and there is damage to mucoperitoneum can happen. That can very be easily done with the ultrasonic equipment. This is the piezotom and there is a rhinoplasty set which we use. We are not using it in all situations, but the situation where we found it useful. Lateral hump, asymmetric hump, medial osteotomies can be done with precision without risk of entering into the cranial plate. Removal or trimming of bony spurs from septum without damage to mucoperitoneum, making a hole in the spine. Hump reduction instead of traditional rasps, it can be reduced with precision with the piezotom bone cuts and rasps. This is a short video showing we are removing the bony hump with initially with the curate of piezotom, and then they got two rasps, the fine and coarse rasps, and that helps in and especially when there are fine irregularities, this is useful because the traditional rasp is a large blade and you have it rasps a larger area where you can here with this curate and rasp you can remove with precision. If you want, you can do it with in under direct vision, or you can use with the feel. And this is the large hump where we are removing the bony hump, and then this is the cartilaginous part which has been removed out. And that's the results on the table with the piezotom and then on the table, and these are the results after 4 months. You can see how the hump has been taken care, and especially the post swelling is less. I found it especially useful in asymmetric hump, when where you have to do out remove out hump on one of the sides and other sides you have to preserve, and these pyramidal osteotomies can be done and with precision. With especially angulated blades provided in the rhinoplastic kit, you are able to do the pyramidal osteotomies, and you can join it with transverse osteotomies if required, which you can do traditional osteotome or you can do it with the piezotom. And the asymmetric hump can be rasped, and even on a mobile nasal bone you are able to use the piezotom. So this is after excision of the hump and then extended medial osteotomies to mobilize the nasal pyramid, and that's the post-op about 4 months later. This is a lateral hump when there are small humps which are producing on both the sides, projecting, and this can be done very well with the bony component can be reduced easily with the piezotom, and you can see out the bony hump has been taken care of, and the results are very natural and the swelling is much less. This is a picture about 6 weeks post-op, and you can see out it looks like that most of the swelling has gone. Another patient where the hump has been taken care with the piezotom. Asymmetric hump, when the hump is going to one side, again on the convex side you remove it with the curate and the special blade provided in the piezotom. A lot of water spray goes along with the piezotom when they are using it. that prevents from heating the tip and provide passing out the heat to the tissues. I found it especially useful in making a hole in the maxillary spine for fixation. So even with a small spine sometimes, or very easily you can make, even with a mobile thing, you were able to use the needle. And the rib cartilage harvesting, though it is a simple procedure, but those who do not want to take any risk of perforating the pleura, that can be done safely. And here we are harvesting a rib cartilage with a piezotome, and you know that you can cut up to the perichondrium and it will not damage the pleura. So those for beginners or those who are doing taking infrequently, this is a safety tool to use, but it takes a lot of time. So sometimes the surgeon gets impatient to remove the graft, and that is how the perichondrium and the pleura are peeled off from the graft. And this is especially useful when you have to cut at when the ribs are fused together and you want to remove only a piece. So you can make a precise cut without damaging the pleura. So this is how a rib cartilage has been taken out. Separating it from the attachment. So only thing is that it's slow, it takes a lot of time, but it's safe. As I mentioned, there are limitations. It is much slower compared to the rotatory drill. Expensive instrument, cost and tip which gets damaged very easily. I have broken 4 needles. These are needle which breaks, and there is a danger that if it breaks inside the bone, you are in trouble. So to conclude, the piezodome is a useful tool and a creative rhinoplasty surgeon's armament. Along with the usual rhinoplasty instrument, this is one of the tools which you can incorporate in your practice. I do not recommend it for all the cases, all the steps, but yes, this is my experience with it.